Here are 4 reasons why wall sit exercises like this one make knee arthritis worse. Reason number 1 is that when you do a wall sit exercise and you're bending your knee joint just like this, you're adding a lot of compression from the kneecap onto the thigh bone. You're lengthening the quad muscle on the front of your thighs, which pulls on this right here. This is the quad muscle tendon, and it attaches to where the kneecap is and then down here. And so it adds pressure and compression to this joint, and that is exactly what leads to worse knee arthritis. And here's the thing though, this exercise is usually given to people with knee arthritis as a treatment for knee arthritis. And so even though the person doing the exercise usually feels that it doesn't feel great, it kind of hurts their knees, it just feels, you feel the compression, it feels uncomfortable to do, but because a healthcare provider might be giving you this exercise, people will grit through it and do it. And people will say things like, it hurts so good, you have to make it hurt to make it work, no pain, no gain. They'll have those kinds of phrases or mentalities behind it. But in reality, it is compressing your knee joints. And if you have an irritated joint lining, the cartilage behind the kneecap and on the end of the thigh bone right here, it's making it worse. It's like you have a cut there, like if you have a cut on your skin and you're just pressing it and smashing it, it's not a good thing for your knee arthritis. Reason number 2 is that this feeds into quad muscle dominance. Now, what I mean by that is the quad muscles are on the front of the thigh right here. They attach to that kneecap. And because of that exercise, you're working these quad muscles. You're making these quad muscles get tired, get fatigued, they're burning, and they're getting stronger as a result of doing this exercise. The problem is that usually quad muscles are already too strong. They're already too dominant in someone who has knee osteoarthritis. And so if you're making an already strong muscle even stronger, what that muscle does at rest when it's strong is it's gently compressing the kneecap against the thigh bone. At rest, because you're so strong, the muscle has a resting tension in it, and it's just pulling the kneecap against the knee. That's why some people get pain at rest. They'll be sitting, they call it the moviegoer sign. They'll be sitting around, they'll be sitting in a car, having a meal, and their knee starts to ache and hurt. And it's because of this increased resting tension from an overdominant quad muscle putting pressure on the kneecap against the thigh bone on an irritated cartilage right in the knee joint. Doing this exercise also gives people a false sense of accomplishment. Because think about it, you're in that wall sit position. If a healthcare professional gave you this exercise, or if you saw this exercise somewhere and you decided to go do it, you feel the quad muscles in the front of your thighs working. They're getting tired. Maybe you're even breaking a sweat from this. Then when you take breaks from the exercise, you feel the pump or the blood flow go into your thigh muscle, and then you feel accomplished because you said, I worked out my quad muscle like I intended to, or like my physical therapist or doctor or trainer told me to do. And so you feel like you're on the right track. But what those people don't do, because they probably don't specialize in healing knee osteoarthritis naturally, they're not understanding how this exercise is actually making knee arthritis worse. And that false sense of accomplishment is fed even further because when you look down, you see the front of your thighs and you feel those muscles working, and so it just gives you feedback that you're on the right track. And then what it leads you to do is avoid working on the real root cause of knee arthritis. And so some people will continue to do this exercise, they'll do lots of it, they'll do extras of it because they get that sense of accomplishment from it, but meanwhile they're getting worse. Another factor is endorphins. Endorphins are chemicals released from your brain when you exercise. If you push yourself to a certain threshold of exercise, endorphins are released, and those are the feel-good chemicals that you get from exercise that actually help to relieve pain. So this is why some people will start to feel pain when they're doing the wall sit exercise. Then the pain will start to diminish after the first set or two. It's because those endorphins are released. And that's also a false sense of feedback because it's your body figuring out how to get through this exercise even though it hurts you. Now, reason number 3 is this wall sit exercise, and there's different versions of it, by the way. There's, again, with a ball on the wall behind the back, like one of those big round stability balls, and you're using that to kind of do up and down squats against the wall. That's a version of a wall sit in my opinion. But then the most common one is where you hold it like I was right at the beginning of this video. that exercise does not really get your glutes involved. And when it comes to knee osteoarthritis, getting glutes stronger is key. It's critical to getting those quad muscles to not be so over-dominant so that you can take that pressure off the knee joint and begin to allow the cartilage to heal in the knee joint. And this is very misunderstood in the healthcare field because most people think, well, if your knee hurts, work the muscles right around it. But usually the knee hurts because the muscles right around it are already too strong and adding too much compression. So we actually have to think backwards about this and get other muscles farther away to get stronger so that these muscles that affect the knee joint pressure can calm down and not work so hard and take pressure off the joints. And when it comes to exercise, that's what people usually get. That's the belief or the mindset from healthcare professionals that are giving their patients exercises for knee arthritis. But in reality, most healthcare is just really pushing people to have medications, to get injections, and to have surgery for knee arthritis, which don't treat the root problem. They're not fixing this muscle imbalance I'm talking to you about. It's just treating the symptoms. And even if you do have a knee joint replacement, as many people do get who suffer from knee arthritis, if your glute muscles are still weak and your quad muscles are still strong afterwards because you never addressed the root problem, then your poor knee joint replacement is going to suffer the consequences of having too much pressure through it, which leads to knee joint replacement failure and other problems caused by the root muscle imbalance. Then number 4 is that wall sit exercise puts you in what we call a fake functional position. Now most healthcare providers will, when I ask them, because I train a lot of physical therapists, when I ask them, how is this exercise, the wall sit, how is this exercise good for a patient? They'll say this often. They'll say, well, it's a functional exercise. And what they mean by that is that it's a motion or an activity that is very commonly done. So training that exercise or that motion or that activity would make sense because then it's going to help you to do that common thing that you do. So they'll say that I'm training the sitting and standing motion. And by training somebody in a wall sit position and getting these quad muscles stronger, they're saying, well, I'm helping somebody to be able to stand up and sit down better. The problem is, at that level where you're sitting with 90 degrees bent at your knees, or maybe even a little bit higher, you're only there for a moment. You're not holding that position ever. I mean, it's extremely rare that somebody will choose to hold that position for some functional reason, some reason that they need to besides doing an exercise. So in my opinion, there's other muscles that are going to help much better with that. Glutes, which you can work out in a squat where you don't lean against the wall, tends to be a much better option. What I'll tell my healthcare professionals that I train is get people off the wall, stop putting them against the wall, because as soon as you lean them back that way, it makes the quad muscles, the thigh muscles work quite a bit. But if you can do a squat in the air in this position, getting your knees out, bringing your hips forward, now you can train the glutes much better and begin to take the quad muscles out of it so that you can correct the muscle imbalance and take pressure off the knee joint. Now that position that I showed right there is a more advanced position, so if you have very bad knee arthritis right now, there's other exercises to start with. Like I said, I go in depth into it. And let me just bring you to that. If you go down into the description in this video here, you'll find a playlist called the Knee Arthritis Help Playlist. It's got all our videos on YouTube that you can access right now to learn more about knee arthritis. And if you want to get our comprehensive program that has my entire treatment approach on how to fix knee osteoarthritis, how to fix the muscle imbalance that causes knee osteoarthritis, then you can find that also in the link in the description below. It's the Knee Arthritis Recovery Program. Hey guys, if this video was helpful for you, please comment on here and let us know that it was helpful for you. Hit the thumbs up button, give us a thumbs up, and don't forget to share this with somebody. You need to let people know about this because not many people understand this, even in the healthcare field. And if you have a friend suffering from knee arthritis, you would make their day if they can begin to learn about how to solve it at the root of the problem rather than just taking medications, injections, and possibly having an unnecessary surgery because they could have fixed the imbalance and gotten over the problem. And if you haven't already, please subscribe to our channel and hit that notification bell so that you don't miss out on any of the helpful videos that we post each and every week. Thank you so much for watching. I'll see you in the next video. Bye-bye.